Hi there, Dr. Andy Toy here from Keep Calm and Carry On Aligning. I don't know if you've seen it yet, but the Itero has a fantastic new tool, the Align Oral Health Suite. It's a great AI-driven way of communicating with your patients and helping report on their state of oral health. It's interactive, it shows them in simple terms where they are now and where they could be, and also if you do the scans on a regular basis, how their mouth is changing. It's a great way of supporting your ING conversation. So take a quick look at the video. It'll get you started in it. There's lots more features as well that I didn't get into, but at least start using it now. And it's becoming really obvious to me that we need to scan every patient. Give every patient the chance of truly understanding their oral health and getting control of that, giving them the best chance of oral health for the rest of their lives. That's why we're here. Hope you enjoy it.
Hello everybody, we're back in exotic Melton Mowbray and I've got a fantastic new tool for you to look at from the Itero. It's called the Align Oral Health Suite. So when you take your scan, you can press on the button here. It takes a little while to load. This is quite quick because I've just been through it, so don't worry if it takes a little while. You've got down here an instruction manual, but basically it's an artificial intelligence supported oral health report for the patient. And you've got all of these different things that you can look at. So let's, for instance, take gum health here. So you've got the patient scan, you can look at gum health, you can see the actual photograph there, you can increase it in size, looking at that little bit of recession, and you have the ability here to use the time lapse, so I think it's this button here, and you can compare it with a scan that you've taken before or after, it's up to you. The scan must be on the same Itero, and so we're looking at this area here, and I'll put the real life view on, and it's that bit there. So you'll see this changes. It's automatically going between the two scans. These are just 3 months apart, and we did a little bit of refinement for Donna in the meantime. So no difference there, but a great way of monitoring gum health. And now let's look at tooth health. So it's the same sort of thing. You can look at the filling very closely. You can look at the bite on that filling. You can again compare the two. This one is NIRI, near infrared imaging. We don't have that facility open on this scan, but that would be another way that you could look at this. So you can look at all the tooth health very closely. I think this would be amazing for new patients, and just let them take a good close look at their teeth and ask them to tell you what they can see. And again, you can do your comparison thing, which is this one. All right, so we've got comparison here. What did we want to look at? We wanted to look at that fill in there, and again you can see it in the real image. See if there's any difference. Okay, you can take screenshots of these things as well, by the way. Always a risk, isn't there? There's too many tools on here, but okay, we've gone from tooth health to gum health. Now let's look at alignment. So we'll take off the occlusion. I'll look at just the lowers, I think. Oops, sorry. So let's say you take a scan of a patient and maybe a year or two later, they want to know if their crowding is getting any worse. And again, you can put it on real life. And you can see the two there. you can also show a color change, you know, how significant that change in position was. There was a slight change there. There was a bigger change there, showing in red. So it's automatically flipping between the two, and you can say to the patient, yes, your teeth have moved in the last year, 2 years, or whatever it is, and they've moved roughly 0.2, half a millimetre, whatever it is. So it's giving the patient clear information about what's happening in their mouth. And this is really to be used as part of the ing conversation. Remember that, Mrs. Jones, your teeth aren't crowded, they're crowding. Your gums aren't receded, they're receding. Your teeth haven't cracked, they're cracking or wearing. It's all helpful so the patient understands the dynamic changes that are going on in their mouth. And I think that's roughly it. There is also an ability to do an outcome simulator where the system will then straighten the teeth as well. So I don't want to show you that one as well. That's that button there. Donna hates this picture, by the way, which is why I'm showing it.
Yeah, great.
So there you can see, if we straightened your teeth, Mrs. Jones, this is what they would look like, and that's what they'd look like there. You're probably all familiar with this already. So that is the Align Oral Health Suite. What an incredible AI-driven tool to show the patients what's happening in their mouth now, and also, if we do it on a regular basis, to understand the dynamics of changing their mouth as well in terms of monitoring. Hope we enjoy it.